James was a bright, passionate artist living in the heart of Toronto. His world was full of color, inspiration, and community. But there was one thing no one knew about him. A secret that caged him more than any locked room ever could. James had an intense, unshakable fear of elevators. It started in childhood, a seemingly minor incident of getting stuck in an elevator for a few minutes. But over time, that fear grew. He would walk up 10 flights of stairs to avoid using one. He'd refuse job interviews in high-rise buildings. Even his relationships suffered because he couldn't travel or go to certain places without panicking. His friends would brush it off come on, it's just an elevator. But for James, it wasn't. It was a phobia. Phobias are more than just fear. They're intense, irrational responses to specific objects, situations, or feelings that pose little or no actual danger. And they're more common than most people realize. According to mental health research, over 12% of adults experience a specific phobia at some point in their lives. Phobias can take countless forms, from common ones like arachnophobia, which is the fear of spiders, acrophobia, the fear of heights, and claustrophobia, the fear of enclosed spaces, to more unusual ones like nomophobia, which is the fear of being without your mobile phone, trypophobia, the fear of clusters of holes, and even papyrophobia, the fear of paper. But what causes these overwhelming reactions? In James's case, it was a traumatic event. That's often the spark for many phobias, a negative experience that the brain sears into memory. For others, it might be learned behavior from a parent or relative. Genetics and brain chemistry also play a role. People with phobias often have an overactive amygdala, the brain's fear center, that misfires, sending out false alarms. And while some might see these reactions as strange or exaggerated, the emotional and physical response is very real. The body floods with adrenaline, heart rate spikes, muscles tense, breathing becomes rapid. It's a full-on fight-or-flight reaction. Phobias aren't something you can just get over. They can affect every part of a person's life: careers, relationships, travel, health, even self-esteem. People living with phobias often go out of their way to avoid their triggers, which leads to isolation and, in many cases, deep shame. James didn't tell anyone for years. He felt weak, irrational, broken. But inside, the fear kept growing. Eventually, after declining a promotion because it would require him to visit the 18th floor of a corporate building, he knew something had to change. That's when he sought help. He was diagnosed with a specific phobia and started exposure therapy, a powerful treatment that gradually and safely introduced him to elevators. It began with just standing near one, then pressing the button, eventually riding up one floor. It took months. There were tears, panic attacks. But there was also progress. And James wasn't alone. Many others live with phobias, whether it's fear of flying, dogs, thunderstorms, needles, or crowds. What matters is recognizing the fear and taking small but brave steps to confront it. Practical steps you can take today. First, recognize and name the fear. Give your phobia a name. Awareness is the first step toward healing, so it's really important to seek a mental health professional. Therapists who are trained in cognitive behavioral therapy or exposure therapy can help you reframe your thoughts and gradually reduce that fear. Another helpful step is to use grounding techniques. Things like deep breathing, the 5-4-3-2-1 sensory technique, progressive muscle relaxation, and mindfulness exercises can all help you manage anxiety. And it's also a good idea to set small goals. Try to avoid avoidance. You can actually create a ladder of fear, starting with what's least scary and working your way up one step at a time. So track your progress and, celebrate those small wins along the way. Keeping a journal can really help you see just how far you've come. And hey, involve a support system. Share your journey with trusted friends or family members. Their understanding can make a huge difference. Educate yourself. Understanding the neurological basis of phobias helps reduce shame and actually empowers change. There are support groups and online resources out there like the Anxiety and Depression Association of America, the National Alliance on Mental Illness, Mental Health America, 7 Cups for free online peer support, and even Reddit communities like Our Phobia and Our Anxiety. Just remember to always verify advice with medical professionals. Also, you might want to check out mobile apps like MindShift CBT for anxiety coping or Calm and Headspace for mindfulness and relaxation. Recovery doesn't mean never feeling fear again. It means learning to live and thrive, even with it. James doesn't love elevators now, but he doesn't fear them either. He takes them when he needs to, breathes through it, and walks into buildings and opportunities that were once locked to him. Because freedom from phobia isn't about eliminating fear. It's about refusing to let it cage you. You're not alone, and you're not irrational. You're human. And with help, you can step out of the cage and into your life again. If you found this video helpful, be sure to give it a like, share, and check out our other mental health education videos. Together, we can help break the stigma surrounding mental health.